So let's talk about ketamine-assisted psychotherapy. It's easily one of the most hyped up new treatments in mental health. It promises these incredible, revolutionary results for conditions that have just stumped doctors for decades. But, with that kind of promise comes a massive responsibility. So, what are we really looking at here? Is it hope or is it just hype? And that really gets to the heart of it, right? Is this thing a genuine breakthrough for mental health? Or is it actually a really dangerous path with some serious, serious risks? Well, the answer, as you're about to see, is not simple at all. It's really a story of two completely different worlds. First, let's look at the incredible promise. I mean, for people who've been struggling with severe depression, PTSD, and anxiety, sometimes for their whole lives, ketamine is being talked about as a total game changer, the kind of thing that could literally transform mental health care as we know it. The pull of ketamine as a therapy tool is that it can create these really powerful, almost mystical experiences. We're talking about promoting a better mood, sparking a vivid imagination, and offering this profound sense of relief from deep-seated anxiety and trauma. For a lot of folks, it's a temporary but incredibly powerful break from a reality that can be pretty painful. Okay, so what are we actually talking about here? This is ketamine-assisted psychotherapy, or KAP for short. And the crucial point, the thing you have to remember, is that this is not just about taking a drug. It's a whole therapeutic method where the ketamine is given in a clinical setting, and this is key. It's combined with psychotherapy to help you process the whole experience. And that brings us to the ideal scenario, what we could call the gold standard of ketamine therapy. This is where the treatment is done in a controlled, professional, and ethical environment that is designed from the ground up for patient safety and well-being. An ethical clinical process is really built on these four pillars. First up, rigorous screening. You have to evaluate a person's entire medical and mental health history to even see if they're a good fit. Then, informed consent, laying out all the benefits, all the risks, all the alternatives, so there are no surprises. Then, the ketamine is only given by qualified licensed professionals. And finally, the most crucial part, integration and follow-up. That's the therapy where you actually process the experience and make sense of it all. This whole process creates what therapists call a safe container. And inside that safe container is a whole support system. This isn't just one doctor in an office. A proper KAP team includes psychiatrists, psychologists, licensed therapists, registered nurses, even empathetic support staff. They're all working together to guide you on a safe and supportive journey. But here's the thing. Even in the absolute best clinical settings, it's not straightforward. That question, is ketamine ethical? It just looms over everything. Because this incredibly powerful treatment brings with it some incredibly complex challenges. This is really the core dilemma, isn't it? On one hand, you've got this immense promise of healing, but on the other, you have this profound responsibility to practice ethically. It's a really delicate balancing act that everybody involved, from the clinic to the patient, has to navigate carefully. So, how do those great principles hold up in the real world? Well, something like informed consent runs up against the natural power dynamic between a therapist and a patient. Rigorous screening has to fight against the potential for misuse. And here's a big one. How do you make sure this amazing treatment is available to everyone who needs it, not just the people who can afford it? It gets complicated fast. And that brings us to the other side of the coin. A huge, stark contrast to that clinical ideal we just talked about. This is the Wild West, the world of unsupervised, non-clinical use, where all that promise can turn into peril really, really fast. This quote, man, it just says it all. It's from a practitioner who ended up developing a dependency. They said they were blown away by its beauty, that the visions were wondrous and delicious. When the experience is that powerful, the allure to just do it again, to escape into that state over and over, becomes overwhelming. And that is the danger. That allure of escape can spiral down into dependency, where a person just gets disconnected from their friends, their family, their own life. They get lost in this private world that eventually just becomes a prison. So we have to be crystal clear about the warning signs. The Ketamine Research Foundation gives some really direct red flags. If you or someone you know is using ketamine every day, stop. If you're experiencing cravings, stop. If you're using it in secret or having physical symptoms like bladder issues, stop. These are huge signals that use has crossed a very dangerous line. And please, make no mistake, this is not a small issue. The source material is clear. Widespread non-clinical use is a global concern. It has absolutely led to dependency, severe addiction, and in the worst cases, accidental death. The stakes here are incredibly high. So, where do we go from here, right? How do we take this incredible promise of ketamine and harness it, while at the same time respecting its very real danger? The future of this therapy really depends on finding a path forward that puts safety above everything else. There are really two parallel paths to safety here. On one side, you've got strict top-down regulation. A perfect example is the FDA's program for the S-ketamine nasal spray, Spravato. It can only be given in a certified clinic, and patients have to be monitored by a healthcare provider for at least 2 hours after. But on the other side, you have bottom-up patient responsibility. And this part is just so crucial. As a patient, you are not a passive bystander. You are an active partner in your own care. You have a responsibility to ask tough questions about risks and benefits, to do your homework, and choose qualified providers with credentials you can verify. You have to give honest feedback to your care team and demand transparency every single step of the way. This is how you empower yourself. In the end, it's maybe best to think of ketamine therapy as a doorway. It can be a doorway to profound healing, to self-awareness, to a whole new way of living. But it can also be a doorway to dependency and disconnection. Which path it leads to, well, that depends entirely on the care, the intention, and the responsibility with which we all choose to walk through it.